everybody. This is Garrett here, co-owner at National Senior Savings, your host on the podcast, The Medicare Minute. You can find that over at iTunes or on Google Play Music. Just type in the Medicare Minute. This is Medical Learning Module number 5. What is a Medigap plan? Sometimes people call them Medicare Supplements. Medicare Supplements and Medigap plans are both one and the same. So what is a Medigap plan or a Medicare Supplement? So original Medicare pays for many but not all healthcare services and supplies. So what a Medicare Supplement policy does for you is sold by a private company, and it pays all or some of the costs that original Medicare does not pay. They call them Medigap plans a lot of times because that's exactly what they do. They fill the gap between what Medicare paid and what you would have to pay out of pocket, therefore leaving you with no money out of pocket at the time of service. Some Medigap policies also offer coverage for services that original Medicare does not cover, like medical care when you travel outside the U.S. Generally, Medigap policies don't cover long-term health, like care in a nursing home. They don't cover vision or dental, hearing aids, eyeglasses, or private duty nursing. With that being said, there are a couple of companies out there that throw in extra benefits to get discounts on your vision or your dental care, your hearing aid. You just have to take a look and see if the value is there for you to get those extra benefits with that company. So with that being said, what we come up on are the types of Medicare supplements. So Medigap policies are standardized. So if you remember from our previous modules, there's close to 2,200 Medicare Advantage plans in the United States. They come in all shapes and sizes: HMOs, PPOs, PFFS, medical savings account, SNPs. Those are all Medicare Advantages, and they're in every county and city and state in the United States. Well, Medicare supplements are much, much different. I'll speak to the 47 states that they are all tailored just the same. So there's only 3 states, Minnesota, Massachusetts, and Wisconsin, that do their Medicare supplement plans different. But other than that, the other 47 states do them exactly the same. And so a Medigap policy has to follow federal and state laws that are designed to protect you. There's actually only 11 policies available on the market, and those 11 policies are exactly the same in New York as they are in California, as they are in Florida, and everywhere in between. Everything is the same. The only thing different is the name of the company you're buying it from and the price you're paying for it. So that's where it comes in, shopping the market, using an independent broker, someone who knows the market, to find you the best deal with the strongest rated company. So what it comes down to is when you compare plans, there's 11 plans, and on this screen here, you're only going to see 10 of them because it doesn't have the high deductible F plan listed. But as you can see, all of them come with some sort of basic benefit, Part B coinsurance. Some of them have skilled nursing facility. Some of them pay your Part A deductible. Some pay your Part B deductible. Some pay the Part B excess. Some of them pay for foreign travel and emergencies overseas. And some of them pay for your preventative care. Well, actually, all of them do for your Part B coinsurance, because preventative care is very important feature that the federal government mandates everybody has to provide. So really the plans that really stick out at this time are Plan F, Plan G, and Plan N. Those are the plans that a big majority of people are going with. A lot of people are now starting to look at Medicare Supplement Plan D as an option also. So what do those plans do real quick? So I'll go back and talk about Plan F for a minute. Plan F's the Cadillac plan. It goes away on January 1st, 2020. That means that anybody that has it can keep it. Anybody that wants to join it cannot join it. It's not going to be available to new members starting then. And Plan F right now at this point pays everything. So you pay your fixed monthly premium, say $130, $150 a month. And based on paying that, anything that Medicare does not pay, that is a Medicare approved service, we're not talking cosmetic surgery or acupuncture or things that are not Medicare approved, but if it's a Medicare approved service, that Plan F is going to pay every penny of your co-payments, your deductibles, everything that you don't pay, you pay through that premium on a month, and then Medicare Plan F pays everything for you. You don't have to worry about it. So what else should you know about Medicare Supplement Insurance, Medigap plans? Well, important facts, you got to have Part A and you've got to have Part B. You pay the private insurance company a monthly premium for your Medigap policy in addition to your monthly Part B premium. So you paying the premium monthly on a Medicare supplement or even a Medicare Advantage plan, because a lot of them come with premiums, doesn't negate the fact you still have a Part B premium that you're paying to the government for you to be able to have that Part B benefit. You can contact the company. They can tell you exactly what your premium is going to be per month. You can go through an independent broker. An independent broker will be able to tell you exactly what your premium is going to be. A Medigap policy only covers one person. Spouses must buy separate policies. You can't have prescription drug coverage in both your Medigap policy and a Medicare drug plan. So see page 95. That's of your Medicare and You book 2017. This comes straight out of it. Now, the point I want to make to you here, there are no Medigap policies any longer that have drug plans built into them. They used to in 2006 when Medicare Part D prescription drug plans came along. They did away with those prescription plans in a Medigap policy. It's very important to compare the Medigap policies since the cost can vary and may go up as you get older. Some states limit Medigap premium cost, and that varies per individual state. The most important thing you need to know is that they're all the same. You want to go with a strong rated company that gives you the lowest price, because even if you went with the most expensive plan on the market, think you were getting the best of the best because you're paying more money, you're not. It's the exact same plan as the lowest price plan on the market. And it can vary by $200 a month. It is just way out of balance there. So when do you buy a Medicare supplement plan? The best time to buy a Medigap policy is during your Medigap open enrollment period. This is a 6-month period, begins on the first day of the month in which you're 65 or older and enrolled in Part B. Some states have additional enrollment periods. After this enrollment period, you may not be able to buy a Medigap policy. If you're able to buy one, it may cost more and be medically underwritten. So realize, by passing it up, the open enrollment period basically for a Medicare supplement plan where there's no medical questions asked, if you bypass that, you're going to get medically underwritten at a later date. So if you have any type of chronic conditions, anything bad, there's a real possibility you may be denied getting a Medicare supplement plan at that point in time. You really should check once again with the independent broker. I always go back to that because the underwriting questions are so different with every company and what each company will allow or not allow as far as someone eligible to join the plan. If you delay enrolling in Part B because you have group health coverage based on you or your spouse's current employment, your Medigap open enrollment period won't start until you sign up for Part B. So let's say your husband or your wife works till they're 68 or 69. You have your group benefits there. You never signed up for Part B. They retire. At that point in time, you sign up for your Part B. You'll have an open enrollment period at that time to sign up for a Medicare supplement plan. So how does a Medigap plan work with the Medicare Advantage plan? They don't, period. Medicare Advantage and Medicare supplements, Medigap plans do not work together. If you have a Medicare Advantage plan, like an HMO or PPO, it is illegal for anyone to sell you a Medigap policy unless you're switching back to original Medicare. If you have a Medigap policy and somehow somebody talks you into joining a Medicare Advantage plan, you probably want to drop that Medigap policy because your Medigap policy cannot be used to pay your Medicare Advantage plan copayments, deductibles, and premiums. So basically, you're paying that Medicare supplement company at that point in time money every month for a benefit that you can't use. If you join a Medicare Advantage plan for the first time, good news here, and you aren't happy with the plan, you'll have special rights to buy a Medigap policy if you return to original Medicare within 12 months of joining. So this means when you first turn 65 and you get that Medicare Advantage plan and you decide, I don't like the networks, I don't like being told what doctors and hospitals I have to go to, I travel much more than I thought I was going to now that I'm retired, you'll be able in that 12-month period to drop the Medicare Advantage and you'll have an opportunity to sign up for a Medicare supplement. It's a really great thing. It's a nice service because when you first start Medicare, you're not sure of what you want to do. It's impossible to know what you're going to do the day you retire. So, in summary, Medigap plans are standardized in almost every state, and there are only 11 plans versus the 2,200 Medicare Advantage plans. Medigap policies offer a one time open enrollment where anyone can join despite their pre existing health conditions. Medigap plans use medical underwriting past the age of 65 unless you are just leaving an employment plan. And it is always wise to contact a licensed professional to help you match a plan to your needs and budget. So when I say independent agents, I'm talking about independent agents that are Medicare specialists, people like myself. Once again, I want to thank you for being here. My name is Mark Garrett, co-owner at National Senior Savings, host at the Medicare Minute podcast over on iTunes or Google Play Music. I hope you've enjoyed this series. Thank you very much. You can always reach us at 800-708-5810 and have a blessed day.